Hi there, welcome back. I'm Dr. Garland with Oregon Sports and Family Chiropractic here in Newberg, Oregon. How do we reach without pain? A lot of my patients will come in with shoulder complaints and have pain with reaching, either overhead, forward, behind them. What is likely happening, and what a lot of times we see, is a shoulder's position will actually affect some of the impingement that a patient might experience. What I mean by that is, for example, our shoulder in a neutral position has a freedom to move around. That ball inside the socket can slide and glide, has freedom to move around, almost a full circle of motion if we have that mobility left. So what we're looking for is a nice neutral position, not too far pulled back and not rounded forward. Now what happens is when our shoulder rounds forward, which is a common thing that we see just due to the reliance on desk work and our society being mostly forward driven, there isn't much that brings us back and kind of opens us up. And so we see our patients kind of adapting to that. And how that affects the shoulder is it essentially brings it out of position to run on the tracks, so to speak. And so there's going to be a change of the positioning of your biceps tendon. Your biceps tendon is then rolled in. Your rotator cuff tendons are then put on stretch and have to wrap around the shoulder versus being in a less vulnerable position right here. That causes impingement with the AC joint. The biceps can get impinged in the front of the shoulder, and those pains that we feel when we reach, those kind of stabs or sharpnesses that we feel, is likely an impingement that's happening. So a piece of soft tissue that's hitting a piece of bone or rubbing over kind of a bony surface or prominence that's causing that pain and irritation. And that might happen once or twice without pain, but a sustained activation of that motion with impingement is going to cause something to happen, so to speak. So either a bicipital tendonitis might start, some rotator cuff irritation, things like that. So what we work on is to help the patient feel how to pull that shoulder back and still reach at the same time. We're not looking for this upper trapezius muscle to overactivate with reaching. We want to actually separate that from our reaching patterns. And so if you have pain with reaching, if this is something that you know is affecting you or someone that you care about, please don't hesitate to reach out to us. This is something that we work with day in and day out. We don't want you to suffer with pain with reaching in your shoulder.